Okay, thank you so much, and a very warm good morning to everybody. Thank you so much, Dr. Ramesh sir, the HOD and principal of the college, and he has encouraged a lot me also in pursuing all this, and also a warm wishes to the faculties, Dr. Arun Mohan, Dr. Vineet, Dr. Prajesh and Dr. Dhanya and dear students. And we have a session, the first session, and your department is being. I congratulate the department in organizing such sessions to improve the academic as well as the clinical acumen of the PG scholars. So after the course, they can enter into different kinds of applications of our subject. So let us directly go to our presentation. And now we are discussing the clinical applications of our Rasa Aushadhis. Not in a theoretical mode, but we are in an applied mode we can discuss. And before entering my presentation, I shall interact with you one or two things. What is your opinion regarding the uniqueness of Rasa Aushadhi? Other than other medicine, how are they unique? Can anybody, any of the PG scholars, if possible, you can answer? Just for a beginning. That's all. No need to fear or nothing. You just can simply answer. What is you consider the uniqueness of Rasa Aushadhi, which helps you as a practitioner or a clinician? Can anybody from the PG scholars, can you answer? Anybody, if possible, you can just it's a perfect combination. Rasa Aushadhis are very much highly Deepana and Pajana, as well as at the same time they are Rasayanas. So it is a wonderful combination, and that makes it very highly valuable for a clinician. So, but we have to apply these Rasaushadhis according to the clinical conditions. So, our aim should be to apply Rasaushadhis to meet current health issues, exploring Rasayanas, and call for revitalization of Rasa Chikitsa. So, actually, it is now, after comparing with modern medicine, our branch is now tapering down, and it was considered as Devi Chikitsa, the superior among all the treatments, but now it is labeled as a non-clinical department. So because of Kaligala, I think everything is turning around. But we can apply all these to save the humanity for the people suffering around us. It's a very valuable weapon in your arms. So, for a practitioner, it's a very excellent weapon. So, before applying this, we have to understand the pathology. Even if it is said in na dushyam, na desham, na dosham, even it is spelled out like that, we should look into the condition of the patient. We should assess the patient well and apply the resolutions accordingly. Then we will get specific results. So we have to arrest the pathogenesis, Sambrapti Vigadana. We have to do the treatment. Without Panchakarmas, we can handle patient by Shamana Aushadhis, by using Rasayanas, by cost-effective ways, and implementing suitable treatment protocols for Jwaradi Rogas. So, just some of the yogas mentioned in Jwara. So, how you apply all this in a Jwara Rogi? If the Vettumaran is not available, it is now a practice that any one of the yoga which is available, if available, you will give. And uh, instead of it, if it is not available, you will get another. But it's not the way. We have to make sense by differential use of these medicines. Even if these all yogas are mentioned in Jwara Pragarna, or in a patient coming to your clinic with a fever, how will you differentiate each? So you can see Vettumaran Guliga, Surya Prabha Guliga, what is the basic difference? The difference between Vettumaran Guliga and Surya Prabha Guliga, even both are Jwarahara. So the main difference you can see that in its content, Vettumaran, the main content is Hingula along with Valsanaba. The other content which we are tagging with is Hingula. While in Surya Prabha, the content is not Hingula, it is Kajali. So the Kajali is more Sukshma. So you can use it where more penetration is needed, more Srodho Shodhana is needed. You shall use Surya Prabha. So for many of the infections in the very tiny parts and all, if you need to enter the medicine, to act the medicine, you have to use more Sukshma. So the Kajali, which is the content in Surya Prabha, makes it more Sukshma and you can apply it more. If you spell the Vettumaran Guliga, you say it's Vettumaran, Vettumaran, Vettumaran. Vettine matana, to remove the vettu, means to, to control the seizures. It is useful. So, by inferring from the name itself, we can see that it can be even used in a fever with complication, like a febrile seizure. Even in a febrile seizure, which is a complication of fever, which the patient may be affected with his brain, the yoga is very potent enough to address that. But you have to ensure that it contains all the ingredients and the method of preparation is proper. Then only the result you can assure. So, all the if you are able to prepare Vettumaran Guliga in your clinic, and then you are dispensing to the patient as a clinician, you can observe the change. It will be acting more. So you have to either prepare it well or to procure from a very genuine source, so that you ensure all the contents in it are there and properly prepared. Then even in the complication of fever, a febrile seizure, you can use Vettumananguli. I have used it. I have an experience. One of my students' father was suffering from seizures, and at the time, I have given the Vettumaran in Gunja Sarasa. Gunja is very much, it is a Upavisha, but Gunja Sarasa, you can even potentize the Vettumaran Kuliga by Gunja Sarasa. Shweda Gunja leaves, you can take the Sarasa of that. You again make Bhavana with Vettumaran. This knowledge I have gained from my Guru, late Sri Chittatingara Krishna Palla Vaidyan. And he used to give to his patient by potentiating the Vettamaran with the Shweda Gunja Swarasa, getting another bhavana with that. So I can see it has a much more effect. So this is a principle which we can apply. Alpasya mahardhatvam prabhudasya alpakarmada. So we can potentiate our medicine more. Even if a yoga is there, we can even potentiate by making another bhavana. Here, when I made a bhavana with the Shweda Kunja Sarasa, It is very much working in a febrile seizure. It is very much potent enough. So you don't need to refer. Many of the times we can manage the patient. So that is the power of our medicines. So in Surya Prabha Guliga, so you can also alter Vettumaran Guliga with the different anupanas you can apply in different conditions. Vettumaran Guliga is very much effective in urinary tract infection. How? When you apply it with a very proper anubana, specific anubana, if you give Vettumaran Guliga grinded in the anubana of water, coconut water, 3 or 4 tablespoons of coconut water, and you take Vettumaran Guliga and grind it and give to the patient, you can see within 1 hour the patient get relieved, not cured, but relieved. That is the effect. So you apply it and see the change in the patient. So much more than the effect of any antibiotic. So you don't have to go to a urologist for a urinary tract infection. You can manage it even with a Vettumaran Guliga, but you have to give it in the specific anubana in coconut water. Pardon? I can't hear. Somebody is telling anything? Dr. Reshmi? No. Okay. So, this is indicative that you have to use the medicine according to the condition specifically and according to the anupana, specific anupana. So, the most important problem in a urinary tract infection is nothing but he has burning sensation, he has even fever, but the most important problem, distress to the patient is urgency in urination. That is a troublesome thing, but it is addressed even in 1 or 2 hours. You can see that the patient has is having a decrease in that urgency. So that is the time duration. 1 or 2 hours you can see the change, observe the change in the patient. So you can also tag Vettumaran Guliga with other Guluji Ghanasattva. You can take a Guluji Ghanasattva and you can tag Vettumaran Guliga with that. And you can use in many of the viral fevers. And in Paitiga Jora, if the patient is having a Paitiga Jora, he will be having uneasiness in his eyes. Netre or daha. So the eyes of the patient will be irritated. Is having trouble in the eyes. He has burning in the eyes. So it is a Paitiga Jora. In that case, Vettumaran Guliga, you can tag it with, you can mix, you can create a combination in which the Guluji Ghana Sattva can be prepared and you can combine it with Vatmaran Guliga and you can use it. It is very excellent in Paitiga Jwara. So in Surya Prabha Guliga, coming to Surya Prabha Guliga, the main difference from the Vatmaran, even though the contents are different in many aspects, we can see more Srodho Shodhana drugs in Surya Prabha Guliga. Instead of Hingula, you can see the Kajali there, so more Sukshma. And it is said that Kasa Shwasahari Mahajurahari Namna to Surya Prabha. Kasa Shwasahari Mahajurahari Namna to Surya Prabha. So if a patient coming to your clinic, not only with fever, but many of the times you can see a mixture of disease. It is not like we study, it is not theoretical. In patient, you can see a mixture of disease. So if a patient is having fever as well as chest infection or cough, today nowadays cough, a lot of patients many of the patients are approaching with incurable cough. So in that case, Kasashwasahari Mahajurahari Namnatu Suryaprabha. So instead of Vettumaran Guliga, Suryaprabha is a much specific choice to that patient. So if you give Suryaprabha Guliga in that patient, it will work more. And you can have a throat gargle even. The kaba has to be removed, a gargle like that with the Tangana, Saindava and the Tribhala you can give. And many other combinations like Kanagasava and the Shwasananda. So what I am telling is that if the patient is not only having fever but associated with the Kabadikya and he needs more Srodoshodhana, instead of Vetumaran, you have to select Surya Prabha. It will give more result, very specific result. So what I mean that even many of the yogas, it mentions it is Jwara. You have to select more specifically. Then you will get more result and in a promising result within a short duration, you can observe the changes in the patient. So before coming to the Arogyavardhini, Hinguleshwar Rasa, Ananda Bhairav Rasa, etc., I need to have a thought regarding the pathology of fever. The pathology of fever, the Jwara, not only fever, Jwara is much more than a fever. Fever plus something else. So what is that? It is not only a rise in temperature. Fever, the Jwara is not only a rise in temperature. What else? Actually, Jwara is nothing but even the external phenomenon or external feature is a rise of temperature. The internal problem in Jwara is nothing but it is under Shvedu. It is under Shvedu. So it is a inflammatory stage. So even though the temperature rise you can see externally, you are actually attending the inflammations in the body. When you are doing a Jwara Chikitsa, you are attending the inflammation in the patient. So most of the patient, they have inflammatory stages most of the time. Amavastha. So in Jwara, you are not only treating to raise the temperature, to decrease the temperature, it is needed, but also you are assuring that the inflammation which has set in, the Andar Shvedu is to be addressed. So Jwara, the entire Jwara can be divided into two. So one is the inflammatory phase, Amavastha, and the second, the entire Jwara Chikitsa can be divided into two. The inflammatory stage, which is the Amavastha, and the next one, what is that? Dhadu Leenavastha. It is the Dhadus are affected. From Rasadhadu to Shukla Dhadu, it may be affected. So that is the second part of the fever. That is the second phase. So when you are dealing with the inflammatory stage, you can use Vetumaran, Suryaprabha, Hinguleshwar Rasa, etc. Ananda Bhairava Rasa, Tribhuvana Kirti Rasa. So Tribhuvana Kirti Rasa is working in due to the Bhavana Dravya. It is also having many of the anti microbial properties also. The Nargundi Sarasa, Dattura Sarasa, all these having antimicrobial properties also. So it is working very well, the Tribhuvana Kirti in the microbial infections also. And in those inflammation is there. We are addressing the inflammation. So Anand, Hinguleshwarasa, only three drugs, Hingula, Pipali and Valsanabha. So even if it is so, it is much more safe than the paracetamol which everybody is taking. It is much more safe. You are purifying Hingula, you are purifying Valsanabha and make it congenial to our physiology. So by our process, what are we making? What are the changes coming? By our process of Shodhana, by the process of Marana, by the process of Bhavana. what is the actual thing which we aim? What is actually we are aiming? Not to accumulate these metals or minerals in the body. What we are ensuring is that it must be metabolized in the body and expelled out. It will not be accumulated in the body. We are preventing a bioaccumulation. For that, all these processes plays a role. So by Shodhana, you are making it homologous, making it congenial to the body, and you are ensuring that there will not be any remnants of the medicine. It will be metabolized in that dose. So be confident that if you are doing the Shodhana and all the process well, you are ensuring that the drug is being metabolized well and there is no more, it is not accumulated in the body. So you don't need to fear about any poisoning that is actually happening. It is gets absorbed, even from the tongue it gets absorbed. Even you can bypass the liver. Why? Because if you are you having experience of uh, giving Siddha Magardaja to a patient? Siddha Magardaja, many of you have given Siddha Magardaja to a patient. You can see within minutes, 5 minutes, the patient's result is coming. So whether it is digested, it is not digested, it is not digested, it is absorbed as such. So Rasaushadis, many of the Rasaushadis, they are absorbed as such and eliminated. So there is no digestion. The liver has no load. So that's why it is Sadyohi Deepana Pajanamcha. It is Sadyohi Deepana Pajanamcha. It is readily absorbed. Even it is doesn't cause any load to the liver. This it is doesn't cause any load to the liver actually. So we need to conduct studies in that regard also. How it is metabolized. Further studies are needed. How it acts, how it is metabolized, whether it is having any. I think there is no role of digestion. It is the liver is actually, we are actually by Puda we are giving Agni. By Puda we are giving Agni. By Bhavana we are giving the digestive enzymes. So what is uh, taking place in your body, we are doing it in a lab outside. Bhavana, you are cutting it first. Cutting it, your mouth is cutting, your teeth is cutting. Then you are chewing with saliva and other digestive enzymes are. Instead of that, we are selecting some other dravadravya and we are grinding it. And many of the bioenzymes are replaced by our dravadravyas. And again, we are making a puda, means, or giving a heat source, means agri is given. So what is happening in a body, we are actually creating outside, and the design is that. And what is our aim? When you give it to the patient, it is directly absorbed without any digestive mechanism. You can absorb. So that is why in Dasadarangani it is said as Tat Sadyo hi Deepana Pajanam cha. So it's a wonderful set of medicines, the Rasaushadis. Even a patient doesn't have Agni Deepana, his or her liver is sluggish and not responding much, you can use Rasaushadis so that it directly absorbs into the system. And that is the importance of Rasaushadis. So, Arogyavardhini, coming to the Arogyavardhini, the differential use. We have already talked about the inflammatory stage in which you can use it specifically. But second phase, we have already told about what is that Dhadu Leenavastha. In Jwara, the Dhadu Leenavastha. So, Dhadu Leenavastha, the Dhadus are acting, affected. In that, you can see that how dhadus are affected. So it acts rasadhatu, it will affect rasadhatu, rektadhatu, mamsadhatu, like that. And you can see a liver involvement in it. the Krindayandi iti Ekrit. So, for converting our Ahar Rasa to Dhadu, the liver is the pivotal organ involved. So, you can see that there is a involvement of the organ liver Ekrit in it, in the pathology. So, that's why in Dhadu Gada, most of the Dhadu Gada Jwara, the liver is involved. The liver is has a, we can see a pathology of the liver there in its samprapti. So, what is the remedy for that? In Charaka Samhita, you can see Tikta, Kirada Tikta, like that for recurrence of a fever, Punaravartaka Jora. And in Dhadugata Jora, the Charaga Acharya has pointed out to use Tikta Aushadas, Tikta Rasa Aushadas. So you can see in Arogya Vardhini, 50% of the Arogya Vardhini contains Tikta. What is Tikta? Kadurohini, Picorasa. So when you when you powder Tikta, the Kadurohini in a mixie, you can taste your taste buds. If you are near that mixie, uh, you can sense the taste of tikta in your tongue even without touching. Through the air, we will get the tikta rasa. That much tikta rasa is kadurohini. So for dhadugada jara, tikta rasa is needed, and tikta rasa dravyas are the best, and that's why Arogya Vardhani contains 50% of tikta, and along with a combination of other rasa rasayanas like what abraga basma, loha basma, rasa gandaga loha abra shurba basma samamshagam. Rasa gandaga, so it's a kajjali is there, so it augments the action of the others. So yoga vahi, like that, and sukshma. Then what are the other contents? Rasa gandaga loha basma. Loha, Abraga Basma, Tamra Basma, all these are rasayanas also. So, in Dhadu Gada Jura, rasayanas are also needed to revitalize the functions of the Dhadu. So, you can say that for a patient coming with the Dhadu Gada Jura, so you have to identify Dhadu Gada Jura. First, you have to diagnose the Dhadu Gada Jara. So you can see that the patient will have uh, repetitions of attacks. Fever is coming in the next month, also fever coming, like Punaravartaga also. And any of the pathology connected to liver the patient is having, then it can be brought under Dhadu Gada Jara. And you can apply Dhadu Gada Chikitsa there. I am not equating, but I am relating. And you can apply Dhadu Gada Jwara, and this Arogya Vardhani Rasa can be used there. So what I am stressing is that even if the indications are Jwara, you can apply the different Rasa Aushadhis specifically by the differential use of it, and it makes a promising result to you. That's my point. So now coming to this Arogya Vardhani Rasa, you can see it can be applied very well. I have experienced that this is very much useful to treat dengue hemorrhagic fever. It can be used in many of the viral fevers. It can be used in the dengue hemorrhagic fever, in which the Dhadugada Jara, we can see, we can relate it to Dhadugada Jara. That's why I have applied not Vettumaran there, I have applied not Surya Prabha there, I have applied Arogyavardhini because of this specificity. So likewise, you can apply all these Rasa Aushadhis in a very specific manner. So this is what I have mentioned, the pathogenesis of Jwara. Amashyam Pravishya, Amamanugamya, Pithaya Srodamsi, Pakistana Chandanasya Jalam. So it is being braked by application of all these, the Samprapti Vigatana happens. And you can see the entire Jwara Chikitsa, the entire Jwara Prakarna can be classified into two Amavastha and Dhadulina Avastha. And you can pick the Rasa Aushadhi or any Aushadhi according to these two phases, two stages. That is very important. So you can see that in Agantuka Jwara, you can use Sanjeevani Vadi. In food poisoning, you can use Sanjeevani Vadi. So in Jwara, you can use all the formulations or all the Rasaushadhis in specific manner. Then in Visha Jwara, Surya Prabha and Amrutarishta is good. For many of the climatic changes, we can see many viral fevers. After the summer, when there is rain coming, you can see lot of viral attacks. In that, if you give 10 ml of Amrutarishta and 250 milligram of Surya Prabha Guligi as a combination, 2 or 3 times daily, and take 24 hours rest. No need of antibiotics. It will cure its own. And drink enough water. So that is how to manage fever, viral fevers. And Vishama Jwara, you can use what we discussed, Arogyavardhini. And for Sannibada Jwara, higher or modern medicines are also the Mrityunjaya Rasam, starting from the Purna Matra, 4 Gudiga, 500 milligrams. So you can apply all these in a very, you can see the results of you if you apply it. So then coming to other Sannipada, in pneumonia like that, Kabab Pradhana Sannipada, we have discussed in Kabaja involvement where you need more Srodha Shodhana, you are using Surya Prabha. But in a pneumonia like condition, you can treat it, it has a very good option by Jayamangala Rasa. Jayamangala Rasa, you can use it is very specific. In Jirna Jwara, Lakshmi Vilasa Rasa, and Swarna Malini Vasanta Rasa, all these contains gold. So the patient, we are providing the tonic to him. Because of the chronicity of the disease, the patient is having little bit less bala. So Baladhishtanam Arogyam Arogyartha Kriyakrama. The basis of our treatment is to increase the bala of the patient. Otherwise, our treatment will not work. So the base of our treatment in Ashtanga Hridaya Jwara Chikitsa, it is said Baladhishtanam Arogyam Arogyartha Kriyakram. So we have to conserve the bala. So if the patient is having a chronicity, his bala will be low. So we have to enhance the bala of the patient. So these are very good because it contains Sorna. So his bala will be increased. Even you can make use of Siddhamagardaja in that sense. Siddhamagardaja is a rasayana which can enhance the bala of the patient. So to increase the bala, it is very important. Otherwise, your treatment will not work. So all these points out that these are the rasayana aushadhis which can be used in chronicity. Even in pneumonia, the crepitus you can hear. But by the use of Jayamangala Rasa, it will be vanished. So it is having a great role in reverting the pathology and increasing the bala and immunity of the patient, and he will become immune, and the chronicity will stop there. But if they are pursuing the allopathic treatment, I am not attacking them, but they will not recover. I am observing in our patient. It is our treatment is much more good because it increases the bala of the patient. So now coming to Rakta Pitta, so I can elaborate what is Rakta Pitta. Do you have you identified Rakta Pitta uh, in your course or in your student life? Rakta Pitta, have you diagnosed it? Can if you can answer, you can tell your. You are not able to answer, isn't it? If you are able to answer, you can tell. Rakta Pitta, have you diagnosed or identified a Rakta Pitta Rogi? So, what is Rakta Pitta? So, we need to understand. Why? Because Kasisa is very good for Rakta Pitta, very good working in Rakta Pitta. Kasisa Bhasma is excellent in Rakta Pitta. It is working well. But you need to know the Rakta Pitta. You need to understand patient. When a patient visits you, you have to identify whether it is Rakta Pitta and diagnose it. Then only you can give Kasisa Bhasma. That's the problem. So, Rakta Pitta is actually a bleeding disorder, but it is much more than a bleeding disorder. Do all the bleeding comes under Rakta Pitta? No. So, what is the peculiarity of Rakta Pitta? If anybody can answer, you can tell. If anybody knows the answer, you can tell. So, what makes a bleed of Rakta Pitta different from other bleeding? If you are injured, you get a bleeding. That is not Rakta Pitta. So, what is Rakta Pitta? It is even if it is a bleeding disorder, what kind of bleeding is it, and what is the pathology involved in it? Anybody? So the thing is that you can see in the Ashtanga Hridayam, Pittam Rektasya Vigrade Samsarga Dushanadabi, Gandha Varna, all this you can see. And last line, you read the last line, Plihado Yagridaschatat. Plihado Yagridascha Tat. So in this Samprapti, you can see that the pliha and egrit is involved. So any type of bleeding disorder, if the pathology involves the liver and spleen, then you can brought it under Rektabita and give the treatment of Rektabita. I am not relating because of intellectual gymnastic. I am not doing it for that sake. We can apply Rektapitta Chikilsa, which is said in our text. Then we can apply it. That's why. So, any bleeding disorder in which the spleen and liver is affected, you can brought it under Rektapitta and give the treatment. You can see wonderful results. So, I have given in the patients of uh, what you call idiopathic thrombocytic purpura. Idiopathic thrombocytic purpura. The patient was treating in the Apollo hospital with the steroids like Visalon, and the bleeding comes. The bleeding disorder, and she was suggested of a bone marrow transplantation. She was at that time the age of 13 years. So actually, uh, when the menarche happened, lot of bleeding, and from the mouth and also nose bleeding. The predominant bleeding was from mouth and the nostrils. From the oral, some bleeds comes from the gums, and from the nostrils, bleeding comes. Then there was a petechial hemorrhage, and the spleen was enlarged. And I have given the Rektapitta Chikitsa, and the most important drug I have selected is Kasisa Bhasma in a dose of 200 milligram and with a proper Anubana. So what is the proper Anubana here? You have to select a proper Anubana, then it will be working wonderfully. So in Raktapitta, what is the best Anubana which I can give? So you can see that Vasha is the Agra Aushadha of Raktapitta. So you can make use of Vasha Sarasa. In Kasisa Bhasma, there is no indication of Vasha anywhere. in the text, but you can have a logic. Why you can use logically the Anupana. So Vasha Sarasa, which is a best, it is a Agra Ushada for Rekta Vitta. I have made use of that and given to the patient. And I have given Pradimarshan Asya with 2 drops of Durva Sarasa to nostrils. The bleeding is controlled. And for correcting the liver and spleen pathology, I have been using that Arogyavardhini Rasa for reverting the pathology, and also a Sahaban of Draksha the Kashaya and Vasha Gulucha the Kashaya. And we could be able to attend the problems. And now uh, she has withdrawn all the steroids, and the building is under control, and there is no need of transplantation. So we could save the patient by applying the Rektapitta Chikitsa. Like a same case, another case, a Glanzmann thrombasthenia from Andhra, a patient from Andhra came, Glanzmann thrombasthenia. Not by the name, I have just referred what is happening in Glanzmann thrombasthenia. And actually, it is a genetic disorder also. A genetic involvement is there. And a lot of bleeding comes from the nose and mouth. And he will be admitted, uh, and a nasal pack will be given, and the steroids. He was also in steroids. So I have identified it as Rektabita and given the Rektabita Chikilsa. And here again, Vasha Sarasa, no, the Kasisa Basma along with the Vasha Sarasa is the main drug which I have selected. And by 3 or 4 months treatment, the patient is now having no more bleeding. It is normal. But what happened in that patient? What makes the bleeding is that the modern science, it says, it illustrates there is a lack of protein which is responsible for blood clotting. That's why the bleeding happened. So how could it be corrected? If there is a if there is a lack of protein in his body, how it is corrected? But I have seen that the patient has no more bleeding by applying Rektapitta Chikitsa. But my explanation to that, we have to explain from practical to theory, not theory to practical. We should go back. So I think how it worked. If there is an absence of protein which is responsible for clotting, then how it worked in him. So that points out our Satkaryavada. The modern medicine, they consider it is a lack of protein, but it may not be like that. It may not be. It's not the last word. The modern medicine is not the last word. It may be present, but it is not acting. What is Satkaryavada? There is no abhava. It is there. It is present. But it may not be working in some condition. So by the Rektapitta Chikitsa, we may be stimulating the mechanism to act. That mechanism is not working. That we can infer like that. And by our Rektapitta Chikitsa, the mechanism started acting. So from theory, from practical, from what we seen, we have to go back. So there may not be the absence. It was not working. The mechanism is not acting. So even if the modern medicine is not a last word, we can correct many of the pathologies. And I have witnessed in this patient. So I have thought how it corrected. Then it came to my mind that it may be Satkaryavada. It will be there, but it is not acting. By our Rektapitta Chikitsa, the mechanism got stimulated and it acted and it corrected. So in our science, it is also said, Urdham sadhyam kabatasma. So it is Urdhaga Raktabittam, it can be treated. It is written. So this patient is a testimonial to me and it increased a lot of confidence to me. So you can see the causes of asthma, lot other applications in Raktapitta Chikitsa. Other than that, with the Nimbu Swarasa or Amalagi Swarasa, it can increase the blood count. In Pandu, you can apply. In Kamala, you can apply. In the liver pathologies, you can apply. In Vasha Swarasa, I have explained. With the Tengin Pukala Swarasa, it can be given even in bleeding. And in Naligera Jalam, it can be used in uh, urinary calculi. But it should be used as a compound like Suryakshara Kasisa. Suryakshara Kasisa. So you can apply Kasa like Suryakshara Kasa in a urinary calculi. How you can apply Suryakshara Kasa? Take Kasisa and Suryakshara. You can take half the part of Kasisa, 1:2 ratio. Like Kasisa, one part and Suryakshara half part. And you can grind it in Nimbu Swarasa and make chakrigas. And you can do a puda. And you the resultant bhasma you take and 200 milligram you give, and it is good for the urinary calculi. It is called a Suryakshara Kasisa, this formulation. Then you can give it in Karaskara Bhalamajja. Karaskara Bhalamajja. So if you are giving it in Karaskara Bhalamajja, if you are processing it with Karaskara Bhalamajja, it is good for Shutra. Shutrakshayagnam Kajaranjanam. It is said that Shutrakshayagnam Kajaranjanam. So for Shutra, it is a systemic disease. It is not merely a hypopigmentation, it is much deeper. And even in the genes, it is imprinted. So it can a little bit cover this. And another formulation is there in which we make a Kubi Pakwa Rasana with the Kasisa. And that is in Dasarakna Samachaya, and that is useful in Shutra for internal consumption. And there is also a external application which used in Shutra Yogi. It's very good, working very well to reduce the hypopigmentation. You can use a powder of three things. What are they? One, Kasisa, raw Kasisa, not Kasisa Basma. Raw Kasisa plus Gairiga plus Baguji. These three in equal ratio. Say you take 50 gram each. Kasisa, raw Gairiga and raw Baguji. You powder it well and you get a combination of this powder. This is very useful in Shutra. For, as an external application, you can apply over the area. Along with Tribaladikera, you can apply. Then coming to the Kumari Surasa, Churnodaka combination. So if you are making a Kasisa Basma with this Drava, Kumari plus Churnodaka, and you can see a liquid medium is being created in which Kumari Sarasa 16 parts and 1 part Churnodaka. Not Churnodaka exactly, it is actually Kalchunamb. 16 parts Kumari Sarasa and 1 part Kalchunamb, and you are keeping it in a bottle for 3 days. After that, this Drava, you make a Bhavana with Kasisa and then make a Grasa with this Kasisa. And after this, you have to make a Puda. This Kasisa Basma is highly Pitta Shamana, and you can see within, you can use it in Jara. And in Jara Rogi, if you record the temperature by thermometer, you can see within 15 minutes the temperature drops. That is the power of this medicine. So these are the applications. Now coming to the unique properties as we have discussed. Salpahi matra vibula gunascha tat sadyohi deepana pajanam cha. This is the uniqueness of the Rasaushadis. So രസപ്രയോഗമില്ലാത്ത വൈദ്യൻ നന്നല്ല കേവലം. It is in Chikilsaka Chindamani. Even though Ramesh sir has indicated Kerala practice is having less rasa aushadis use of, yes, but in a Malayalam text, a Malayalam grantha text, it is written Rasaprayogam illatta vaidyan nannalla kevalam. In Chikilsaka Chindamani you can see that, because you have we if it is there is no resaushadi with you, you are many times you should refer to modern medicine. But if you are able to handle with the resaushadis, most of the time you can handle your patients well. That's why it is like this. So some more drugs we can go through. The loha basmas. मृदानि लोहानि रसी भवन्ति निघ्नन्ति युक्तानि महामयांश्च अभ्यास योगा दृढ़ देह सिद्धिं कुर्वन्ति रुग्जन्म जरा विनाशम. So for curing fatal disease you can use loha basmas, swarna rajada loha tamra vanga etc. For attaining a stable body like loha Dhaduvada we are using for making your body stable as rasayanas. So Swarna and Rajada, how it differ? Swarna Bhasma and Rajada Bhasma, how you differentiate? Both are rasayanas, both are belya, both are having rasayana guna, both are vrishya. How you differentiate Swarna Bhasma and Raupya Bhasma? So this makes sense. This makes you a good clinician, the differential application. So what you select is that what you have to think, what makes the difference, Sorna and Rajata, even if it is Rasayana, even it is Brahmana, even if both are Vrishya, you can see that there is a basic change. What is that? One is Madhura and another is Amla. And again, other thing, the Rajada is Lekhana. That makes the difference. So Rajada Bhasma, you will be applying it even if it is a Rasayana, you will be applying it where there is you need a Lekhana. Lekhana, you need to give a Lekhana in that patient. In a Sambrapti Vigatanam, if you need to apply a Lekhana aspect, you have to select, not Swarna. You have to select Rajada. So, for treating many of the infertilities, even both are Vrishya, so many of the patients, they are not having a Garbhashya Shodhanam. Some Srodha Shodhanam should be there. So you can use the Rajada Bhasma. So likewise, you have to differentiate. So metallic Bhasmas, you can use it very well. In many of the degenerations, you can use Swarna Bhasma. Many of the degenerations, neurodegenerations. Now, many of the cases are increasing the what do you call the uh, degenerations of the brain. Many of the diseases, including the Parkinson's spectrum of disease, all these are increasing. And you can select a Swarnabhasma or a Swarnabhasma containing formulations in these neuromuscular degenerations. You can use it very well. You will be getting good result. Even if the prognosis of the disease is not curable, you can manage it. Like a yapya, you can manage it. Not suga sadhya, it is not suga sadhya, but your medicines will be much better than the contemporary medicines which they are using. It can be used, this Swarna Bhasma and the formulations containing Swarna like Brihad Vada Chindamani Rasa, then Sona Gulgulu. All these can improve the neurodegenerative conditions and neuromuscular degenerations. So if the patient is not capable to afford Swarna Bhasma, what will be your option? You have another option. What is that? Can anybody say? Please, can anybody of you please respond? Any one of you can come to your mic and respond. Instead of
Sir,
Swarna, what will you use?
Swarnamakshika, sir.
No, it is not exactly Swarna Makshika.
Godanti Basma, sir.
No. You can have a similar effect in neurodegeneration with another Rasaushadhi. So I can say that. There is Abraga Basma. So you can see the properties of Abraga Basma in what you study in Abraga Basma. Gauri Teja Paramam Amridam Vada Pitta Kshayaknam Praknya Bodhim Prasamidarujam Rishyam Ayushyam Agryam. So what is that? Vata Pitta Kshayaknam. So degeneration is a condition in which it is Vada Pittotara. There is no Kabha in it. It is dryness. It is degeneration. So it is Vada Pittotara. So Abraga equates that condition. It can attend that condition. Vada Pittotara. Vada Pitta Kshayagnam. So you can apply that. And what type of degeneration? In the next line it is said is Praknya Bodhim Prasamidarujam Rishyam Ayushyam Agrim. So Praknya Bodhim, what is Praknya? Praknya is intellect. It is not concerned with the kidney, isn't it? It is not concerned with liver. Praknya is concerned with brain. So Vata Pitta Kshayaknam Praknya Bodhim. You combine both and an application can be meant out from that. And that is, you can use it in neurodegeneration, neuromuscular degeneration also. So even in Prameha, those patients who are in diabetes mellitus, those who are having chronicity in that, their dhadus will be affected. Their muscular, even muscular strength and all degenerations are happening. Their dhadus are debilitated. In that also you can use this Abraga Basma along with the Vanga Basma or Trivanga Basma. In those patients you have to combine with Trivanga Basma. But in neurodegenerations, you can use Sarna Basma or Abraga Basma. And that will be acting very good. So you can see Loha Basma. Loha Basma is having a different action. The Basma of Kandaloha. Kandaloha is best one because Kodi Gunadigam because it has high oxygenation power. I have given in a patient in COVID time. He was having a drop in oxygen saturation, and this Kandabasma acted well. It is having a high oxygenation power. So Lohabasma is different from Kandabasma. It is not a Kanda. It is actually Kandabasma is having a higher degree of oxygenation. This Lohabasma is good in Lekhana and it is having a good action in fat metabolism. Whenever you look into the formulations, you can see in addressing the fat metabolism, in the derangement in fat metabolism, Loha is there, like Ayaskriti, like Lohabasma, and many of the formulations contain. So, for any of the pathologies connected to the fat metabolism, you can use Lohabasma. So, any of the pathologies related to infertility, you can with the Rodha, you can use Raupya Basma. You can use brain degenerations, neuromuscular degenerations, etc. Swarna Basma. And you can see Tamra is another one. In many of the cancer pathologies, you can use Tamra. Why? Because Tamra is highly lekhana and rukshana, and it can what you call it is having a very good anti-tumor activity because it is highly lekhana. So in many of those growths, many of those tumors, you can use Tamra. But you should use Tamravasma after Amrdigarna. Otherwise, lot of complication can happen. And a very practical dose of Tamravasma. If you are going to give Tamravasma to your patient, give it in a very, very less dose so that it is very safe. A 10 milligram of Tamravasma is enough, or a 20 milligram of Tamravasma is enough. Not more than that. That is a practical dose of using Tamravasma in patients. And the Abragabhasma, when you are going to use Abragabhasma, you can test its genuineness. It should not contain any luster. The Bhasma Parisha, you have to go for a random check whether it is safe. It should not have any luster. If a Abragabhasma contains luster, I have seen in the market, in many of the companies, the Abragabhasma showing luster. You should not use it. So you should use without luster the Bhasma. You make it sure. So it is a very good, excellent Dasayana if you use it. And many of the conditions you can use. Even in dry cough, you can use the Abraga Bhasma. So the Abraga Bhasma, you can see, as we have discussed, is Vada Pitta Shamana without vitiating Kapha, Agabham. And it is a Billium for a patient with having chronic diabetes and all. You need to have, the patient will not have any problem. He will have his dhadus are affected. He will not, he will also have many of the sexual problems also. For that also Abraga is good. There is a Vrishya Mayushyam Agryam, and it is Prajna Bodhim, a stimulator of brain. And many of the mental degenerations, many of the depressions, I have used in patient Abraga Bhasma in depression with along with the Kalyana Girda I have given, and he had a very good suicidal tendency, and after using of our Abraga Bhasma for 1 to 40 days, the suicidal tendency decreased and he can come out of that depression. So it is also having very good impact on the mental faculties as well. I have seen in the patient. And also in child development disorders, we can use Abraga Bhasma for many of the patients for not curing but for getting better result, better benefits to improve the quality of life we can use. So you can use many of the anupanas of Abraga Bhasma like Medhya Rasayana with Grida, Go Grida, with Maha Kalyanaga Grida for these mental faculties. It was very good. Medhya Rasayana, you can use it even in dementia patient. In the start of that, it is acting. But after we couldn't cure that dementia or what do you call the memory loss if it is chronic. when when a patient, I have applied it when they started this memory loss, I have given Abraga Basma with this Medhya Rasayana. It acted well. But if it is so chronic, it is not having any action. So with the what is Medhya Rasayana in Ashtanga Hridaya, it is said Medhya Visheshena cha Shanga Pushpi Kalkam Brayunjida cha Shanga Pushpya. You can see the Medhya Rasayana. And you can even make a grida out of that. So Gandaga is another important thing which you can apply. In almost 90% of the skin disorders you can apply. Why? This Ama Shoshana and Ama Pachana. Gandaga acts in skin disease, many of the skin disease. In many of the psoriatic cases also, 200 milligram of Gandaga Rasayana one time, and another time Gandaga, this Rasa Sindura with Mahatikta Grida, you can get good result in even in psoriasis. So why this Gandaga Bhasma is acting in skin? Because you can see that the skin is formed from Rasadhatu. So the Rasadhatu and Raktadhatu should be clear. Then the skin will be clear. It is not skin deep, it is much more deep. It will be, the pathology will be in the Rasa and Raktadhatu. And you have to clear it. You can see that it is Shirat Sandhanika Iva, like a scum. It is formed from the Rasadhatu. So you have to clear that. That's why it is acting in skin disease, because it is Amon Mojana Shoshana Vishahara. It's Ama Pajana, Ama Shoshana and the Vishahara. And it clears the Rasadhatu, and the skin disease get cured. And you can use Gandhaga Rasayana, a very good combination containing Gandhaga. So, lot other applications with many media, like with Tribhala and Bringaraja Swarasa. It is useful for eye disorders, Drishti, Grudrakshi Tulyam. It is said that in Dasharak Grudrakshi Tulyam. So, the improve the vision, the power of vision shall be improved. Then Nagara with the Gandhaga with the Nagara and Tambula as a combination can be Pajana, can use in Ajirna. And along with the Guruji Sattva, if you are combining with the Guruji Sattva, you can treat non-healing ulcers like arterial ulcers. So external application uh, with Gandhaga Malaharam, it is good in many of the skin disease. And the last is Navanidajam. What is Navanidajam? When you are purifying Gandhaga, you can see that in the milk, lot of Gandhaga particles will be there. That you can convert to curd, and that curd, from that you can churn it into this butter, and a ghee is made out of that. That is Navanidajam, which I coined a name Navanidajam. And you can apply externally this Navanidajam, 2 or 3 drops over this Vibhadika, cracked food. It is healing. One or with 1 or 2 times application, it will be healed completely. So for external application, you can use it. So the Abraga, you can see it is Vada Pitta Shamana, Loha is Pitta Slashma Shamana, Tamra is Kaba Pitta Shamana, Vanga is Kaba Vada Shamana, Kasisa Pitta Shamana, Kandam Vada Shamanam. Like that, we can apply in all the pathologies. So this, I am sharing a case report of ulcerative colitis with you, and you can see the patient was very tired with a HB of 3.31 coming to me with a severe ulcerative colitis. And at 10 year, he has a history of 10 years of irritable bowel syndrome and ultimately ulcerative colitis. He was in medical college for treatment for 10 years and went to Amrita Institute, Ernakulam 4, and they suggested a colonectomy to cut the colon. At that time, with this HB, what says HB 3.31, he came, and after giving our treatment with this Rasashastra, within a period of 1 month, the HB has raised to 8.7 and then to 9.7. And after 6 months, I have given after the patient has no complaints after 6 months, and he gained the HB level. He maintained the status well. Weight gain was there, and he became normal with all his activities. And there is no, you can see in the patient after 6 months, no other significant abnormalities detected in the USG. So since there is no complaint, I didn't give a what you call the colonoscopy. The patient has no problem. So why I give him to trouble him? So I didn't give. With this, I have ended. The patient is still living much more health than me. Is now living without any trouble. So there is a strength of our treatment. So I have given a treatment by considering it as a grahani. Not only grahani, the ulcer was there. So 1 cup of blood is bleeding per rectum every day. He's losing 1 cup of blood. So we have to arrest that also. So there is a vrana inside. The vrana is not outside, it is in the intestine, it is in the colon. And we have to heal it, that's all. And there is a inflammation around. Shobha and vrana, shobha and vrana. And the functionality we can, the due to this inflammation, the system is not working, it is not absorbing, assimilating anything. So we can consider it as again a grahani. And what I have given to increase the blood count, I have said I can use what you call Kasisabhasma to increase. But I haven't used the Kasisabhasma in this case. Why? Because we need to treat the cause, not the symptom. So the cause is a loss of blood there, and there is a wound there is inflammation there is no assimilation there. I have to attend all this. And if I am giving a medicine like causes of asthma, it increases for increasing the HB. It is not it will not act. So you have to correct these basic problems in him. So what I did is that to wound that heal with what is best for Vrana Robana Tribala is best. So for Grahani the best one is Kaidaryadi Kashaya. So Kaidaryadi I have given, but I have altered Kaidaryadi by adding there is Chukkonda Munu Karvepila Padhya Padola Nannale Ulga. So Padola 4 times there in the yoga, but I have reduced to one. Why? Because 10 times he is going to toilet. So 4 times Padola he didn't tolerate. So I have reduced it to one. So there is Alpasya Vimartadvam Prabhudasya Alpa Karmada Kudyat Samyoga Vislesha. So I am taken Vislesha. I have subtracted it. So another thing I have added, Samyoga, I have added what? Tribhala. There is only what Chukkonna Munugarvepila Padhya, only Padhya in it, only Padhya is there. But I have added Vibhadagi and Amalagi and raised it to Tribhala so that the patient will have healing of his ulcer inside. So uh, his household has a kaidari tree, the curry leaves tree in his home itself, and a fresh curry leaves are being taken, and this decoction is taken. Along with that, Shangabhasma, I have selected Shangabhasma, not Kasisabhasma, because this is Grahani, this is Amla the patient omits a bout of phlegm, a bout of phlegm every day. So the Amla is there. So Shangabhasma, in order to regulate the enzymes in that area, the best one is to address it with the Amla Pitta Hara Aushadha. The Shangabhasma is the best one. So I have selected Shangabhasma instead of Kasisabhasma. And Kaidaryadi Kashaya, a modified Kaidaryadi Kashaya is given. And the Arogya Vardhini Rasa is also given. And I could see the change within 1 month. The bleeding has arrested, and you can see the change in the previously you have seen the change in the HB level from no from 3 point you can see 3.31. After starting our treatment, it raised to 8.7, and after month 9.7, and then almost in 10.5 it remained for 1 year. Now is perfectly okay. So this is how we can make use of our resources according to the condition you have to select, and not by its indication. So is another case report of cholangiocarcinoma, and you can see that. The adenocarcinoma of the bile duct, and the patient has very good there's no appetite at all. There was no appetite at all. There was no sleep, highly constipated, and a dull ache in the stomach, a painful. He was mostly in a painful stage. And after this, the patient, when he came, look at the bilirubin level 5.3. This is another one, direct bilirubin 2.5. You can see the SGOT 86, SGPT 47, and the alkaline phosphatase is very much raised, which is typically in this disease, like 1568. And 12/11/2010, you can see the date. And in the next month, 12th month, the next one, you can see how the liver responded in this cancer patient. So our medicine, I have given Arogyavardhani Rasa, I have given Mandura Basma, I have given a Mahamandura Sindura, which is having much more bhavana. It is a traditional yoga. And another one I have given, along with that, I have given this Mandura Basma, Drakshadi Kashayas, Anupana, and the liver responded well. So our medicines not harm liver, it cures liver. So in the next month, you can see it's a solid evidence that the SGOPT, SGPT, it all became normal, and the bilirubin from 5 it has gone down to 1. And this cancer patient, which is a very weak patient, this liver responded like this. He was an alcoholic. The symptoms reduced well, but after reducing the symptom, he again went back to alcoholism, and we could not treat more, and he ended in death. But the thing I highlighted, when we give our medicine, how the liver responded, it is Arogya Vardhini itself. So this is a comparison of the liver functions. So this is a case of benign prostatic hyperplasia. You can see the volume 102 cc, and in the next month you can see the volume reduced to 81 cc, is a 15 to 20% reduction in the prostate size. And I have used the Varadiga Basma also here, Kanmada Basma, and Vastya Meyandaga. So the Lekhana of Varadiga had also made it, shrunk the volume of the prostate from 105 cc to 81 cc. So it's another case with 25 grams of prostate. It's a just started one. And in the next visit in the next month, 19 cc, normal. This is a case report of prostate cancer. So I have very good news to report. I went to prostate PSA test last week. My PSA has gone down from 11.5 to 3.3 now. Next, I went to biopsy where they took 12 cores from different parts of the prostate. It was all completely clear and there was no cancerous cells. So thank you for all that you did. Your medicines made all the difference. What should I do next? Oh, so after 10 to 12 years of follow-up, now he is healthy. He was a non-resident American, NRI from Kochi, and Alan, and it was his right mid area. You can see the adenocarcinoma, 6.06 centimeter. And in the next scan after 6 months, you can see in the scan itself, you can see no cancerous lesions. It's only benign. So this was the lesion. You can see it in the right mid area. Now in the next scan, it is only benign. This is a comparison. So I have given a special formulation, Lekhu Logeshwar Rasa, in which the Varadiga is there. We are filling one part Rasa Sindur and four part of Gandhaga in it. And we are sealing it with Tangana and making a Puda. And that Bhasma in 250 mg, I am giving it to the patient along with Vastyame and the Grida. And the Chiruvilluadi Kasha I have given as Anupana, and very good result. And still now the patient is normal, and he is not taking any medicine now. So these are some more results that in the about thyroid nodules and some of the other cases. So we are now coming to our time limit. Other basmas also we can use Shanga basma, Kasisa basma. These are not mere supplements. You don't consider it as supplements. Supplementation is not our idea. It is an idea of modern medicine. We are correcting the metabolic pathways. We are not using supplements. Don't use it to increase the iron. Don't use it to increase the calcium. You can use it, but you are correcting the metabolic pathways, not as a supplement. So Pishti, Malaharas, Drudi, all this you can make use in different conditions of the. So applications of researchicals are it is in degenerative diseases, genetic disorders, cancer treatment, emergency management. You can also make use of Pottilies also, and to minimize surgeries, which we have seen in many of the cases which I shared with you. So in acute conditions also you can use Shwasakudarasa. In acute respiratory distress, which a patient is gasping before you, a patient coming to a clinic gasping for air, you can use Shwasakudarasa. You can convert the Shwasakudara yoga into a Dhuba yoga. You can make a Dhumapana with that. You can see instant relief. Within 5 minutes, the patient got relief. And Shardi, it's many times difficult to control. And in Vittamar and Guliga has an Anupana of Kachura Swarasa, Legusuda Shegarasa, according to the cause we should treat. Kasa, different pharyngitis, laryngitis, tonsillitis. This Padiga Basma and Panikurka is a very good combination. And for productive cough and cough with sputum, you can use different medicines in a specific mode. Grahani, which we have already discussed about Shangavasma, Arogyavardhan, and even Ashtakshari Guliga. And Amla Pitta also we have discussed along with Shangavasma, Dhatri Loha, Arogyavardhan Dasa are also excellent. And Hritshula, that we can cover in another session. We can treat it, Hritshula, in according to the different pathologies of the heart. We need another 1 hour for that. So I'm not attempting this time Mutrakrutsra. You can treat it well with Shila Kanmada Basma, then Rasasindura in Gokshila Kwada. And you can make use of Sheda Parpadi, very simple formulation which you made it as a practical and is very good for urinary calculi and in many of the urinary tract infections and even in Shweda Pradara, leukorrhea also. So Vadaroga, it can be, you can use specifically Vada Gajangusha, especially for Pakwashe Gadavada. If it is having a disc slip or disc collapse, Vada Gajangusham is more specific. Vada Vidwamsana Rasa for Dhaduksheja Vada Vyadi. For Samavada, you can use Vada Rakshasa Guliga. Brihadvada Chindamani Rasa for Pakshagada or Ardida. Then Mahayogaraja Gulgulu for osteoarthritis. Smrudisagara Rasa for Abasmara. And Abraga Basma for degeneration of brain, Parkinsonism, etc. And developmental anomalies in children. So Yagardvigaras for treating liver, you can use the in Kamala Chikitsa, Shilasat Basmam, Mandura Basmam. For even attending the structural damages of the liver, you can use Annabedi Sundura, Mandura Basma, Shanga Basma, and along with proper Anupanas, even Chiruvillu Adi Kashaya is having very good role in curing many of the pathologies. Amardotara Kashaya you can use it as Sahapana. So Prameha, Shivaguliga, Loha Basma, Vasanda Kusmagar Rasa, Abraga Basma, Vanga Basma, and Trivanga Basma is very much specific in Prameha of having a good chronicity. You can use the complication in the complications of Prameha, Vasanta Kusmagar Rasa. Amavada Rasa, along with Eranda Thaila is very useful even in pain, reducing the pain of Amavada. So toxicity studies, many of the studies have been conducted. A particle size study I have conducted for the Bhasma of Leguro. You can see that these are nanotubes. In the Bhasmas, nanotubes are identified. So these nanotubes, you can see many of them are having gratings, rough surface. And you can see many of the molecules are able to attach with this rough surface. That's why the role of anupanas in Rasaushadis are very important. So these are the salient features: Anutvam, Sukshmatvam, Vyabhagatvam, Vyavayitvam, Shikragaritvam, all these. And it not the level of action, it not only acts in Annamaya Kosha, it influences the subtle Pranamaya, Manomaya, Vijnanamaya, and even the Anandamaya Kosha. And that's why the yogis made use of rasa to attain perfection in life. That we study it as Raseshwara Darshana. And that's why it is an expansion of Rasayana Chikitsa, and that's why it's a Devi Chikitsa, the superior among treatment. And you can see the Rasayanas in our text, lot of Rasayanas, and the concept of Kshetrigarana to make our body capable to absorb these Rasayanas, and the karmas for doing Kshetrigarana, like Pajanam, Snehanam, Svedam, Vamanam, Rejanam, Tada, Edani Panchakarmani for Rasaushadis and for Rasayanas. So in systems, broad spectrum action, emergency medicine, and the guidelines, Sagandha Murchida Sudo, Chiragalam Parishilada. So if your Rasa Ushadi is having Gandaga, processed in Gandaga, it is more safe. You can use it for long. But it is not having Gandaga. You should be cautious, and for those you should be cautious. So in Rasadarangani you can follow the pattern of Rasa Sindura. Up to 1 year you can use a dose of 7.8 mg. So you should ensure that it should not be more than 10 milligram, and up to 2 year not more than 20 milligram, and up to 6 year not more than 40 milligram, and up to 12 year you can use 50 mg, and as adults one these guidelines you can follow as a general guidelines for the dose. And the pratyaushadis, we can also make use of pratyaushadis. Even there is no toxicity, there can be some hypersensitivities according to patient, and you can make use of the antidotes, which is well described in our classics, and specific antidotes are also mentioned, and the rational use of the resaushadis by assessing the condition of the patient, dosage, duration, diet, anupana, and regular monitoring is essential for a successful practitioner. And we could not come across a branch in modern medicine equivalent to Rasashastra. It can be developed as a nanomedicine or nuclear medicine of Ayurveda. So we are wrongly equating it to some other things. It is actually a nanomedicine or nuclear medicine of Ayurveda. In order to tap its full potential, it will be beneficial to our system and our people if we develop it more. And the ancient wisdom of converting a poison to the most potent medicine requires a lot of self discipline and perseverance. But the fact that it benefits the entire humanity is the inspiration behind such painstaking efforts, bowing our head before such great seers. And thank you so much for listening my talk. Thank you so much for giving me the opportunity to present before you. And in Amrita, I feel a second home to my after my college. The Ramesh sir and all the faculties there, Prajesh, Arun Mohan, all are very much cooperative, very much friendly to us, and also guiding in many of the aspects. Thank you so much. Thank you for listening, and I wish all the students to make use of this knowledge to apply. It should not be not in your notes. It should be in your patience. You should apply it in the future too. It will, you should have to apply. Thank you. Thank you so much.
Why? So that you couldn't complete, I know. Hopefully, we will be able to have many more split sessions in future so that we can discuss very detail about each system or each preparation.
Thanks.
And as you said, the relationship between Anand sir and Amrita will keep on going. We will keep it intact. I hope our future generation of students also will get benefit from a lot of your knowledge and inputs. And
Thank you, sir. Thank you.
I
Sir.
do have one more meeting scheduled. I will be leaving the class now, and Prajesh will continue. If students have some questions, they will interact. And thank you for being a first guest. And I need your blessings and prayers for a successful continuation of this series of talks. Sir. Thank you very much.
Thank you so much, sir. And I am very privileged to be with you. Thank you. Thank you so much. And I wish all the success in this venture. And it should continue and it will boost the young generations. Thank you so much.
Okay. Thank you.
Sir, could you just explain regarding the Pathya that is normally followed while describing the associates in clinical practice?
Okay, that's a very good question. Usually we have to follow two types of padhyas. One is a roga padhya. According to the disease, you have to design a padhya. Follow some other things. That's for Rasaushadis, you need to avoid Tishna Dravyas. Because the Rasaushadis as such are Tishna and Ushna most of the times. You need to avoid Tishna Dravyas for and Ushna Dravya and Kadu Dravyas you have to reduce. Like pickles, you have to advise the patient to not to take pickles. And the Vidahi Dravyas like curd, it's better to avoid curd. Rather, you advise them to take morigari with processing it with turmeric. You can advise the patient, and also you have to avoid spicy food, and which many of the patient will be taking the fast food culture, and you have to reduce it. As the most of the Rasaushadis are Tishna and Ushna, these precautions you have to add along with the other Roga Padhya and the Rogi Padhya. Okay.
Thank you.
Okay. And also, I need to hear from you how you attended it, how you could gain from this presentation. What is your understanding regarding the presentation, and how you benefited from this also?
The session was very nice. Actually, in Kerala, we don't use that much of resources in our practice. So only in textbooks we are hearing about the applications and all. So actually, this session helped us very lot to know regarding the administration of medicines. Basically, in such conditions like amla pitta and all, even in CA also, we can treat with rasaushadis. It's a far knowledge for us right here in Kerala itself. Other sessions
Okay.
will help us.
Okay, fine.
Say one more about this.
Okay, you can ask. I couldn't hear. You can come front and I ask, I think.
കുസുമാര ഒരു
Ah,
പേഷ്യന്റ് കഴിക്കാൻ വേണ്ടിയിട്ട് പ്രിസ്ക്രിപ്ഷൻ കിട്ടിയിട്ടുണ്ട്. അപ്പൊ
ah,
അവരിങ്ങനെ എത്ര കാലം വരെ ഉപയോഗിക്കാം, എന്തൊക്കെ ശ്രദ്ധിക്കണം, വേറെ ആരോ പ്രിസ്ക്രൈബ് ചെയ്തതാണ്. പക്ഷെ അവര്
okay.
കോണ്ടാക്ട് ചെയ്യാൻ പറ്റില്ല തോന്നുന്നു, അങ്ങനെ
Ah,
ചോദിച്ചു. അപ്പൊ എന്തൊക്കെ
okay.
എത്ര
ഓക്കെ
കാലം?
ഓക്കെ ഓക്കെ. ആക്ച്വലി നല്ല ഒരു സോഴ്സിൽ നിന്നാണെങ്കിൽ ഇഫ് യു എൻഷുർ ദി ജെന്യുവൻനെസ് ഓഫ് ദി സോഴ്സ് യു ക്യാൻ യൂസ് ഇറ്റ് ഫോർ ലോങ്. അതായത് ഇപ്പം 6 മാസം വരെ വസന്ത കുസുമാകരം കണ്ടിന്യൂസ് ആയിട്ട് യൂസ് ചെയ്താലും പ്രശ്നമൊന്നുമില്ല. ഇറ്റ് ക്യാൻ ബി, കാരണം അതാണ് ഞാൻ ആ ഗൈഡ് ലൈനിൽ സഗന്ധ മൂർച്ഛിത സൂതോ, ഇപ്പം ഇതിൽ സഗന്ധമാണ്, പക്ഷേ അഗ്നി അല്ല, ഒരു കല്ലുയി രസായനമാണ്. എന്നാൽ പോലും അത് ആ ഒരു ഡോസിൽ കുറച്ച് കാലം ഉപയോഗിച്ചാലും ഇറ്റ് ഈസ് ഹാവിങ് എ രസായന ഗുണം. അപ്പോൾ അത് ആക്ച്വലി ഇറ്റ് ഈസ് എ രസായനം. ആൻഡ് അതിനൊരു ടൈം റെസ്ട്രിക്ഷൻ ആക്ച്വലി ഇല്ല. ബട്ട് യു ഹാവ് ടു എൻഷുർ ദാറ്റ് ഇറ്റ് ഈസ് പ്രോപ്പർലി പ്രിപ്പയർഡ്. അതിലെ കജ്ജളി തന്നെ പ്രോപ്പറായിട്ട് പ്രിപ്പയർ ചെയ്തില്ലെങ്കിൽ ഇറ്റ് വിൽ ബി സ്പോയിലിംഗ് ദി പേഷ്യൻറ്റ്. സോ only thing is that you have to ensure the safety and authenticity of the source. Otherwise, you can use it for long, no problem.
സർ, ഗന്ധകദ്രുതി നമ്മൾ ലിക്വിഡ് ഫോം ഓഫ് സൾഫറിൽ യൂസ് ചെയ്യാന്ന് പറഞ്ഞു, പക്ഷെ അത് പ്രാക്ടിക്കലി നമ്മൾ ക്ലിനിക്കലി ഏതിലൊക്കെയാണ് യൂസ് ചെയ്യാറ് സർ?
ഗന്ധകദ്രുതി ആക്ച്വലി പ്രാക്ടിക്കലി കണ്ടമാനം ഉപയോഗിക്കാൻ പറ്റുന്നില്ല, കാരണം ഇറ്റ് ഇസ് ഹൈലി തീഷ്ണ. അത് നമ്മൾ തന്നെ അതിലൊരു 3 ഡ്രോപ്സ് ആണ് ബീറ്റിൽ ലീഫിൽ രസന്തൂരം കൂടി ചേർത്തിട്ട് കൊടുക്കാനായിട്ട്. അതൊരു കോമൺ പ്രാക്ടീസിൽ കണ്ടമാനം യൂസ് ചെയ്യാനും പറ്റുന്നില്ല, കാരണം ഇറ്റ് ഈസ് ഹൈലി തീഷ്ണ. ഒരു വളരെ റെയറായിട്ട് മാത്രമേ ഞാനും അത് ഉപയോഗിച്ചിട്ടുള്ളൂ. അത് ഇറിറ്റേഷൻ ഉണ്ടാക്കാം, അത് ത്രോട്ടിൽ ഇറിറ്റേഷൻ ഉണ്ടാക്കാം. ബട്ട് ഒരു കാര്യം നമുക്ക് ചെയ്യാൻ പറ്റുന്ന, ഏറ്റവും ഹൈപ്പർട്രോഫീഡ് ആയിട്ടുള്ള കണ്ടീഷൻ, കഫം വളരെ കൂടിയിട്ട് ഈ സ്ട്രക്ചേഴ്സിലെല്ലാം വളരെ ഹൈപ്പർട്രോഫീഡ് ആയിട്ട് നന്നായിട്ട് അങ്ങനത്തെ കഫം കൂടിയ കണ്ടീഷനിൽ മാത്രം സെലക്ട് ചെയ്യുക. ഇപ്പോൾ ഒരു അല്ലെങ്കിൽ അത്രയും തീഷ്ണത കൊണ്ട് തന്നെ അത് കുറച്ച് മ്യൂക്കോസെ ഇറിറ്റേറ്റ് ചെയ്യിക്കാൻ ചാൻസ് ഉണ്ട്. സോ അത്ര ഹൈപ്പർട്രോഫീഡ് ആയിട്ട് ഈ ഉള്ള കണ്ടീഷനിൽ മാത്രം ഉപയോഗിക്കാം. ഓക്കെ.